That's the beauty about naturopathic medicine, because it's not a cookie cutter approach. Whereas conventional medicines, oh, you have high blood pressure, you do this. These medications oftentimes cause more harm than good, and they should not be used long term, but these people are on it for years and their doctor doesn't pull them off. Women's healthcare is broken. Women go see their doctor and they're like, I feel like this, I'm gaining weight, I'm crying all the time, or I can't sleep. So many women are suffering and they don't need to suffer, and they've just been dismissed and given just a poor advice, and it's really disheartening to see and hear. You'd be surprised at how many women think that they can get pregnant every single day of the month, and that's false. Testosterone is a huge one for women. It can be game-changing for a lot of things, especially when it comes to weight loss. Is your relationship on the brinks because your libido is non-existent and your husband's like ready to file for divorce or put his eyes on somebody else?
Welcome to the Superhuman Blueprint Podcast.
Hello and welcome to the Superhuman Blueprint Podcast. I am your host, Drew Griesel from Primal Wellness Coaching. Today, I am going to be talking to Dr. Erin Ellis, a naturopathic doctor out of Gilbert, Arizona, which I am very excited about. I have been interested in naturopathic medicine for a while now, but have never taken the opportunity to find and talk to a naturopathic doctor. Before we get into the episode, I do want to ask you to please make sure you hit that subscribe button, hit that like button, leave us a review. All of the interaction that you do with our podcast helps to push our podcast out to a broader audience and get us more listeners. More listeners means more people learning about health and wellness and living a healthy and well lifestyle. Also, show notes for today's episode can be found at the superhumanblueprintpodcast.com. So anything that we mention that would be linked will be there for you. So let's talk about Dr. Erin Ellis. So Dr. Ellis is a naturopathic doctor who specializes in helping women balance their hormones, fix crappy periods, and regain energy that they once had and help them to be their happiest, healthiest selves. She's got her own story. In 2010, Dr. Ellis was diagnosed with a rare form of non-Hodgkin's lymphoma, which was a turning point in her life and then prompted her to pursue her dream of becoming a naturopathic doctor. Having had cancer at such a young age, it created a mission for Dr. Ellis to empower others to take control of their health just as she did on her own path to recovery. So I am very excited for this conversation.
Okay.
Dr. Erin Ellis, welcome to the Superhuman Blueprint Podcast.
Thank you, Drew. I am very excited about this conversation. Thanks for having me.
My pleasure. And this is take two after some technological troubleshooting, but here we go again. So, Dr. Ellis, I have been interested in naturopathic medicine for a long time, and I have had a keen interest in actually seeing a naturopathic doctor, but I never have, and I've never actually even spoken to one. So this is my first conversation with a naturopathic doctor, so I am very excited about this. But for our listeners that are unfamiliar with what that is, can you just give an overview of what naturopathic is, and I guess do that in comparison to allopathic medicine or our traditional Western medical system?
Yeah. So naturopathic medicine is alternative medicine. Really, it's we abide by 6 different naturopathic principles, and I'll run through some of my favorite ones. First is do no harm. So we usually choose the most least toxic and least invasive therapy first. So we don't give a pill for your ill like traditional medicine. You know, you go in, you have a headache. Oh, here's some prescription pain relief, or oh, you have diarrhea, here's an anti-diuretic medication. We don't really just do that. We try to get to the root of why you have the symptoms that you have. I like to use the analogy like I'm that annoying little toddler that's always asking why is this happening? Why do you have the headache? Why do you have the diarrhea? Why do you have awful cramps? Why can't you sleep at night? Why are you so tired? There's a reason why you feel the way you feel, and your symptoms are messages. So we need to get to the root of why it is. And that way we can give the body what it needs. Your body has the true capacity to heal itself if we understand what's going on. And furthermore, it's all connected.
Are you running on empty and reaching for that Gatorade or sugary juice again? It is time to cut the crap and fuel your body the right way. Ultima Replenisher Electrolytes are my go-to solution, packed with essential minerals like calcium, potassium, zinc, manganese, and chloride, and all with zero sugar. So here's the truth. Being low in electrolytes can lead to brain fog, fatigue, overall sluggishness, and many people live with mineral deficiencies and they don't even realize it, settling for a lower level of energy every single day that they think is normal. Electrolytes are crucial for maintaining hydration, supporting nerve function, and regulating muscle contractions. Without them, your body struggles to operate at its full potential, leaving you feeling drained and unfocused. So Ultima Replenisher Electrolytes are designed to address these deficiencies and keep you at the top of your game. By replenishing essential minerals, Ultima helps you to stay hydrated, energized, and mentally sharp. Whether you're crushing a workout, or navigating a long meeting at the office, or chasing after the kids, Ultima ensures that you have the stamina and clarity you need. The benefits extend beyond just hydration, though. The variety of delicious flavors means that you can enjoy staying hydrated without the added sugars and artificial ingredients found in typical sport drinks, and you won't get bored because they seriously have a lot of flavors, and they are all good. I've tried them all, just about. Even my kids love Ultima, and I feel good about giving them a healthier alternative to juice. So visit primalwellnesscoaching.com/Ultima. That's ULTIMA, primalwellnesscoaching.com/Ultima to get yours today. Eliminate brain fog and dominate your day with renewed energy and focus.
So your body is a whole. So we treat the whole person. We don't just look at one area, and we're really getting a comprehensive look at your health. And by doing that, we can also help prevent disease processes from happening. So you don't need to be sick to go to the doctor. You might appear healthy on the outside, but are you healthy on the inside? And that's where naturopathic medicine shines, because like I said, we look at the body as a whole. So we run a comprehensive set of lab work to really see all areas of your insides and if there's excesses or deficiencies. And then we usually, like I said, treat without medication. I mean, there is a time and a place for medication. And I'm licensed in Arizona, so I have full prescribing rights. So I can prescribe. However, there are some states that are not licensed for naturopathic medicine, so they are unable to prescribe. So hopefully it's going to be, so back in the day, if you recall, chiropractors started off kind of like how we were. They weren't mainstream medicine. Everybody thought they were crazy and weirdos, and they weren't covered by insurance. And that's exactly how naturopathic medicine is starting. But I think since, post COVID and the pandemic, I think a lot of people are really, starting to pay attention to their health and like, whoa, I wonder if I am healthy, or maybe, I could be healthier or whatever. And then I just try and, scream for as many different platforms as I can and tell people, you don't need to suffer with whatever it is that you have going on. You don't need to be dismissed by your doctors. You don't need to be left feeling hopeless, which is one of the reasons why I named my practice Hope Natural Health. It's because when I was going through my own health journey and why I got into this profession, I had the hope that I would be okay. And now I instill that same, mentality with my patients. It's like, there's a reason why you feel the way you feel, and you don't need to suffer except like, that's just the way it is, because we can, be our healthiest, happiest selves. We just need to really get to the root of what is going on. So that's pretty much how we differ from conventional medicine. Now, we need conventional medicine. Like I said, there's a time and a place for medications. And I really hope one day that it evolves where we have a naturopathic doctor on our team. We have the PCP and the conventional medicine doctor on our team, and we all can integrate together, because as naturopathic doctors, like we have, intense, significant education in nutrition and supplements and things like that, where conventional and allopathic medicine, they don't really have a whole lot of that. They're just like, oh, here, eat less, or maybe exercise more, or maybe eat less carbs. Well, no, that's not the answer to your weight gain. So I think there needs to be all of us on a team, and, hopefully one day that will come to fruition. But for now, it's just, trying to educate and teach and spread the word about what naturopathic medicine is, and do things like this. And here, it helps you out.
So there are a couple things you said that stand out. So one is kind of the comparison and the knowledge base on health between a naturopathic approach and an allopathic approach, right? And this became apparent to me when, as a personal trainer, as a fitness and nutrition coach, and then eventually a kind of wellness and lifestyle coach, I had some clients that were traditional medical doctors, allopathic doctors, and I would be coaching them on certain aspects of nutrition or lifestyle. And I would be like, hey, you probably already know this, but make sure whatever, or do this. And they'd be like, yeah, I kind of know about that, but don't really. So yeah, I don't really, I touched on it in, a little bit of a textbook at one point, but didn't really learn much. And that was shocking to me, because this is health, right? This is not, so I'm not talking about sickness. They know way more about sickness than I know. I don't know anything about sickness, but then when it came to health, in so many ways, I knew more than they do. And I'm just a guy.
Yeah.
So that was shocking to me. So then, in learning about naturopathic medicine and naturopathic doctors, it's like, okay, that's where the focus, you know about sickness, but you also know about health, right? And you can coach people on maintaining health or moving from sickness to health, and not just caring for sickness.
Absolutely. Yeah, that's spot on. And like I said, with the prevention, I mean, that's where the prevention comes into play. And, you don't need a lot of, I forget the percentage, but it's a big percentage of disease processes can be, prevented if we know that they're happening. So oftentimes we go to the doctor and it's when it's too late. I shouldn't say too late, but it's progressed to the point where it's going to be, you're going to have to do a lot of work to reverse it. Or maybe you can't reverse it. But had you, taken tabs on it earlier, we could have prevented things from happening. And that's health. But it's hard in our society because there's no, we have the whole, the pharmaceutical industry and the whole insurance industry, and there's no wealth in health.
Yeah.
So they really want us to be sick. So that's why I think naturopathic medicine gets such a kick, a bad rap in the conventional medicine world, is because we're actually trying to make people healthy, and they don't want us to be healthy, which is unfortunate, right?
It is. It's a sickness is a for-profit industry.
Right?
Yeah, it's unfortunate. And so it's something that became apparent to me just in conversations with friends. I'm early 40s. I have a lot of friends that are my age, 40s, late 30s. And I really didn't realize until I started talking to people about health and wellness that so many of them are on cholesterol and blood pressure medication. And when I talk to them about it, they don't know anything about why they have hypertension or high cholesterol. They just know that the doctor saw it in the numbers and put them on some medication. And maybe they were told to cut out the sodium, like and so the lack of understanding of their own condition, and the fact that most people generally are willing to just take a drug because that's what their doctor told them to do, without telling them, without exploring, the condition that they have, and maybe reversing the condition rather than just treating the condition. Like, that is something else that made me want to do what I do, which is, help people to just lead a healthy lifestyle, but then also to understand more about what you do. Is there a different doctor you can go to that will help you to maybe reverse this, or just to know more about it, if nothing else?
Yep. Yeah. And it's interesting, especially with like high cholesterol and blood pressure. So oftentimes people are put on blood pressure medication for like one reading in the office. And I can't tell you how many times I've heard that people in my office have that white coat syndrome. I don't wear a white coat, but they still get very, very anxious and nervous when they go see the doctor. So what's going to happen? Well, their blood pressure is going to increase. And so they oftentimes have a higher than normal blood pressure in office, and their doctor freaks out. And then they're like, oh my God, you have like high hypertension here in the office. Here's a, beta blocker. And it's like, whoa, 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 whoa. Like, no. I always ask the patient, I'm like, do you normally have high blood pressure? No. Do you know normally what it is? They'll tell me. I said, do you get nervous at the doctor's office? Or here, why don't we get you a home monitor? You can buy one off Amazon. take your blood pressure morning, afternoon, and evening, and let's get, several days of readings and see if it
Yeah.
truly is high. I mean, I don't even think there's been one case where it's really, truly been
Really?
high, or they've come to me with the hypertension. And I'm like, well, have you ever tried to get off of this? Like, maybe you fixed it. Maybe it wasn't even really
Yeah.
hypertension to begin with. And so we'll wean them off and see. And then we go through that. And same thing with cholesterol. It's like, oh my gosh, you have a cholesterol in the 200s. Like, you're gonna fall over. No, not always. Like, why is it high? What are you eating? What can we maybe add more of or take away from your diet? Like, we don't need to always go on a statin right away just because you have one reading of high cholesterol. I've definitely seen high cholesterol go down just with very basic nutrition guidance. And I think that's a big thing that sets us apart from medical doctors is the whole diet and nutrition consultations and educations
Yep.
that we can provide.
Yeah, that was one of my first successes I saw as a personal trainer. Was someone came to me because they wanted to lose weight, because that's what people come to personal trainers for. And
Yeah, right.
so he already had a decent fitness routine, but not much control over a lot of lifestyle things and nutrition. So we dialed in his fitness, just made some minor adjustments. I gave him some, to your point, some relatively basic nutrition guidance, and then made some lifestyle adjustments, just, observing an eating
Mm-hmm.
window, just moving more, getting out for more light, things like
Yeah.
that. And again, he was with me for the intention of body composition, but he had high blood pressure and he had high cholesterol. And we weren't even talking about that until he went and got his labs, and his doctor was like, what are you doing different? Because everything looks so much better. I'm like, this is basic stuff. I'm just a trainer. Like, why wouldn't the
I
doctor
know,
have had him doing this
right?
anyway?
It's the things I hear, and back to what you said with the medications, I ask everyone, I'm like, why do you take this? I'm like, I don't know. They told me I had a high blood pressure, or they told me that I had um the high cholesterol. Or why do you take the supplement? Oh, it's to help my blood sugar. Well, what's wrong with your blood sugar? I don't know. My doctor said it was high, and I look at their labs. I'm like, I
Yeah.
don't see it high. So yeah, it's a lot of times, just like you said, they take it because their doctor tells them to, but they don't know why. And they don't know how long they need to be on it. Can they, maybe address this in 3 to 6 months and say, all right, maybe I need something right now to help me get out of the scary state that I might be in with my labs, and then I want to really work on this and learn more about it so that I can reverse it. And that's totally fair. But I mean, we're even a good example of a medication that I see patients on a lot is like the PPIs, or like a meprazole for GERD
Mm.
or reflux or something like that. It's like, ugh, these medications, like they oftentimes cause more harm than good, and they should not be used long term. But these people are on it for years, and their doctor doesn't
Yeah.
pull them off. And
Yeah.
it's like, well, let's heal your gut and figure out why you have it in the first place. So I mean, if you take anything away from this podcast, if you have some sort of symptom, like I have a headache, be like, okay, maybe I should just ask myself why. Like, let's start with the why do I have this? Why do I have acid reflux? Why do I have a tummy ache all the time? Like, let's see if we can figure out why this is happening. It doesn't just happen. Like, there's a reason
Right.
why. So, and then you can figure, like, why do I have high blood pressure? Is it because I'm anxious? Am I not moving enough? Maybe my diet's contributing to it. All those things that you teach people too. So start with the why and ask yourself that, rather than just being like, wait, I'm not going to take this pill. I want to know
Yeah.
why I have this.
And I respect medication as a treatment in appropriate circumstances,
Absolutely.
and I've seen medication do wonders for people. But living
Absolutely.
a medicated life is a whole different thing. And I've seen situations
Oh, yeah.
where, like, my dad had a heart, what's it called, where the it goes out of rhythm from time to time. What is that? Yeah, arrhythmia.
Arrhythmia. Mm-hmm.
And so he got put on a heart medication, and they said, you're just gonna have to be on this for the rest of your life. And we're like, but why? Can you at least tell us why?
Yeah. Why?
No, we can't tell you why. We just
Yeah.
know that this could, it could be bad,
Is
and you
there,
want to be on this.
or yeah, or ask, you can simply ask, is there another alternative?
Yeah.
What are my options? Like, you don't have to take exactly what they say too. Like, do I have any other options? Is there a way to do this naturally? Do I have any natural alternatives? That's the beauty about naturopathic medicine too, is it's not a cookie cutter approach. Whereas conventional medicine's like, oh, you have high blood pressure, you do this. Whereas in naturopathic medicine, it's like, all right, well, you have high blood pressure. We could give you a med depending on how high it is, but here, maybe we'll try this and we'll try this and we'll try this and wait. Oh, okay. That didn't work. Here, let's try this. So we have so many different tools in our toolbox to address things that, that's another thing you can ask your doctor too. Like, what are my options? I know that there's more than one, and they oftentimes will only present you with one option, but that's where, being an advocate for your own health and knowing like the questions to ask is so important. So you don't just like, get that fear mentality, like, oh my gosh, my blood pressure is so high, I'm going to, have a stroke if I don't get it in control, which, yeah, I mean, is a possibility, but let's figure out the why you have it and then ask for other options.
Yeah. Part of my, the situation my dad went through, he had a form of bone marrow cancer. And so of course we went to the oncologist, and they're like, okay, we're going to get you on chemotherapy. This is your treatment plan. And we're like, okay, cool. Like, yeah, let's kill those cancer cells. But what can we do to make chemotherapy suck less? What can we do to battle this condition that he's in beyond chemotherapy, just using lifestyle and nutrition. And the oncologist didn't have a lot to say until we would do our own research and say, well, can we talk about these things that we've discovered, this dietary protocol or these vitamins? And then it would turn out that, yeah, she did know a little bit, but she would never go there without us prompting her. And even then we could tell her confidence and her ability to speak to those things was pretty limited.
Yeah. I see that a lot too.
All right, let's role play.
Okay.
I'm now your patient. I'm healthy. I feel great all the time, but I just want to know what my deal is with my body, like how I'm doing on the inside, even though I feel fine. So what do we do?
Yeah. So, I mean, even if you come to me with like general wellness, just like you said, like, hey, I want to know my lab levels. I want to see where my status is for my hormones. Like, what's my thyroid doing? Like, I'm still going to go through a giant intake with you and go address every single body system. So starting from, general symptoms to, what medications do you take? What supplements do you take? We're going to talk about your diet. What do you eat? Breakfast, lunch, dinner? How much water do you consume? What's your stress levels like? What are your energy levels like? Do you have any depression or anxiety? We're going to talk about all of your male reproductive issues that you might have or concerns. We're going to talk about your bowel movements. We're going to talk about your sleep, how many hours you sleep. Do you wake feeling rested? Do you wake or have trouble falling asleep, staying asleep? What else are we going to talk about? Let's see, abdominal things. We're going to talk about your hair, your nails, your skin, your eyes, your throat, your heart, your lungs. Like, we're going to talk about every single area of your body. And then we will order lab work. Comprehensive lab work is usually done on almost every single one of my patients. Sometimes we might add some specialty labs like, food sensitivities or, maybe some environmental toxins or autoimmune panel, depending on, the case. It's all, specific by the patient.
You use the dialogue to figure out what custom labs you might want to order.
Yep. And with my women, I know we're talking about you, but with my women, I time all of their labs with their menstrual cycle if they're menstruating. Because as a woman that's menstruating, your hormones are different today than they were yesterday. So we want to make sure we get them in the last half of the cycle, which is the best representation for female hormones. But for men, we're still going to draw the same hormones, mostly. I mean, men are driven by two hormones, primarily testosterone and cortisol. But we'll check those. We don't have to time them with anything, but all labs should be done first thing in the morning, fasted, good 12-hour fast, 10 to 12 hours, no exercise, because the exercise can actually factor or inhibit some or play a role in, changing up or making some of the lab levels look a little different, specifically cortisol, maybe even cholesterol. even your thyroid. So we always ask fasted, no exercise before you have your labs drawn, but it'll be a full panel, the reproductive hormones, a full thyroid panel. When I say full, like conventional medicine only runs TSH, and your thyroid stimulating hormone tells me nothing about your thyroid. I need to see a T4. I need to see a free T3. I might look at a reverse T3. I really want to see your antibody response. Do you have an autoimmune condition? Because sometimes you might have an okay TSH, but your thyroid output is not normal. So why? Do we need more nutrients? So we're going to run some nutrients like vitamin D, vitamin B12, folate. We're going to look at some inflammatory markers. We're going to look at a full iron panel, your cholesterol panel, your blood sugar. I think that's pretty much it. When I do my labs, it's, usually anywhere from 4 to 11 pages, depending on the lab company that I use, just to really get, like I said, the best look at your body. And then once we get the labs back, I go through them, why I ran them, what they mean, where your levels are, where they should be, and then what we can do about it. Well, is that adding more things in the diet? Is that taking away things from the diet? And I'm not a huge fan. When I say diet, I just mean like, what are you consuming? I don't really put anyone on a diet. I don't like diets. I find them to be restrictive, but I like to meet you where you're at. So say you're eating like 2 eggs for breakfast, or maybe even 1 egg. I'll be like, hey, add another egg. We need a little bit more protein. Or instead of having 2 pieces of toast for breakfast, maybe only have 1, because you're having fruit and you're having oatmeal. Like, that's a lot of carbs. So let's maybe pull away some carbohydrates. But I really want to meet you where you're at when it comes to diet. And then we might add in some supplements. So common supplements that I usually give to almost everyone are vitamin B, like a B complex, vitamin D, depending on your levels, maybe a fish oil. Magnesium is a big one. CoQ10 has actually been a big one lately. And then hormones, like whether you need maybe some thyroid support, or for men, like testosterone replacement therapy. I can prescribe testosterone in Arizona. Or for women, like progesterone therapy, or maybe estrogen therapy, and then thyroid medicine. If, all the other boxes check off and we're like, oh, well, maybe we do need some thyroid medicine because you have this, and this going on. But I always, give all the options to the patients. I'm like, if you want to take a medication, I can prescribe it to you, or we can see how your body does if we give it what it needs. And then 3-4 months down the road, if we're still struggling with this symptom and this symptom, and you're not there yet, then we might introduce a medication. So I always like to have the informed consent, and we're kind of like a team working together, rather than like, you need to take this. This is your only option. We have many different things in the toolbox, and it's really, really cool to see labs, 3-4 months down the road, which is typically what I do next. Is you'll start your protocol, whatever we decide on, and then we'll redraw not all the labs, but most of them in about 3 or 4 months, just to see how they compare to the first time. We can tell if you're absorbing well or not absorbing well, or maybe this isn't working, but we're also checking in on the symptoms too. So if you came to me with, say fatigue, and you rated your energy maybe a 4 out of 10, which is pretty low, and now you're maybe at a 7, that's amazing. That's a great, improvement in a short amount of time. So that's what we're looking at, is like little baby steps. I like to call them in the right direction for healing, because healing, you didn't, like, you're in your role play, we don't really have a whole lot of complaints, but most of the time, women are suffering with a lot of things. And I always like to remind them, they didn't get this way overnight, and they're not going to feel better overnight either. And then you add in this thing called life, and we're thrown curveballs all the time. Or say somebody's sick, or you had a really stressful week at work, or maybe a pet passed away, or you had a family member pass away, or you have life. And as women, like, we're super, super sensitive to external stressors and factors and things like that. Not to mention the toxic environment that we live in as well, that's impacting our hormones and everything else on a daily basis. So that's why I like to redraw in 3 or 4 months and just see those like small increments of improvement. I mean, some people improve way faster than others, but again, we don't want to compare ourselves to others, but just knowing that we're moving in the right direction, but also mindful too, that we might take a few steps back. And that's perfectly fine. So that's typically how it works, initially with me. And that's the other nice thing about naturopathic medicine is we're all different. So there's some, of my colleagues that view us as, competition with each other. And I
Okay.
do not at all. I think that I am completely different from my colleague that is one of my, my good friend that's a colleague, and my other good friend that's a colleague. And I refer to everyone because we all practice different. And that goes back to, like, we all have different
Yeah.
tools in our toolbox, and we all have different experiences. We all have different clinical experience too, that can help us, steer people in different directions if whatever we've tried
Yeah.
initially does not work.
Stop settling for mediocre self-care. Higher Dose has the tools to take your wellness to the next level. With their innovative at-home wellness devices, these devices harness nature-inspired technology to release dopamine, oxytocin, serotonin, and endorphins, the feel-good chemicals that elevate your mood and vitality. Higher Dose's range of infrared, PEMF, and red light devices can transform your health and beauty rituals, leaving you rejuvenated, refreshed, and glowing. I use all of these biohacks every single day, and the results are incredible. One of my favorites of their products is the red light mask. The device is a game changer for facial skin health and collagen production. It helps reduce fine lines and wrinkles, giving the skin a youthful, radiant glow. I got one for my wife, and she loves it. They also actually just introduced a red light ball cap, which is designed to promote hair growth and improve overall hair health. By using the same powerful red light technology, this cap stimulates hair follicles, encouraging thicker, healthier hair. It's an easy, effective way to tackle hair thinning and enhance overall hair quality. So if you are ready to elevate your self-care routine, visit primalwellnesscoaching.com/higher dose, primalwellnesscoaching.com/higher dose, and use code primalwellness15, primalwellness15, for 15% off everything site-wide, with the exception of their bundles, subscriptions, and their full saunas. Don't wait. Experience the transformative power of Higher Dose and feel incredible every single day. Stop drowning your food in sugary, chemical-laden sauces. Seriously, what are you doing to yourself? Toss that trash in your pantry and go shop at Primal Kitchen. Their condiments, sauces, and dressings are free from added sugar and packed with clean, non-inflammatory ingredients. Imagine enjoying your favorite meals without the junk. Keto certified, non-GMO, paleo, kosher, gluten-free, whatever you need, they have an option for you. They even use cage-free certified humane eggs. Think about it. Every time you pour those store-bought sauces on your food, you're dumping a cocktail of preservatives and hidden sugars onto your plate. It's nasty. Don't do it. Don't ruin your healthy meals with that crap. What's awesome about Primal Kitchen is their products taste good. They taste like the real deal. So you don't have to compromise your health for flavor. With their products, you can get the best of both worlds, health and flavor. So do yourself a favor and stop poisoning your body with generic garbage. It is time to upgrade to Primal Kitchen and eat like you actually care about what you're putting into your body. Trust me, once you go primal, there's no going back. Head over to primalwellnesscoaching.com/primalkitchen. That's primalwellnesscoaching.com/primalkitchen and get 10% off with the code primalwellness. Again, that's code primalwellness at checkout. Make the smart choice today. Your body will thank you.
So that's the fun thing about what we do too, is there's no cookie cutter approach. There's no one size fits all with.
Yeah. And I am very interested in visiting a naturopathic doctor and kind of going through the protocol that you just described, because
well, you're in a licensed state. There's NDs everywhere in California, so you will not have trouble.
I know, actually, I know of some around here. I just, I have not taken the step to go do it. So I just got to go do it. I'm inspired now. And because I do feel good, right? I'm not sick. And so I don't have a sense of urgency, but I hear about, all these things people discover even when they do feel good, and then they make these changes. And even though they felt good, they go from good to better, or good to amazing.
I want to touch on that. That's one of my favorite things I hear all the time, is like, yeah, I feel good. And then we dive into some things and I'm like, do you really feel good? Maybe you feel good because you felt like this for so long. You don't know what it's like to feel good. Yes. So that's a big thing that we want to look at too. It's like, I actually could probably feel better. So remember that too when you're thinking about your own
live life with inflammation, then all of a sudden that just becomes normal. And
people that struggle with energy, it's like, oh, I'm just so used to it. I wake up, I don't have any energy. I always take a nap in the afternoon. I'm like, yeah, but that's not normal. They're like, what do you mean? I'm like, but just because it's normal for you does not mean that it's normal. I'm like, you should have the energy from the moment you wake up to the time you go to bed to do what you want to do without having to live on caffeine, without having to yawn or like think about a nap or like really struggle to get off the couch and
Right.
finish your day. I mean, yes, we all have those days where that's going to happen, but you should have enough energy to do the things that you want to do all
That's
day
something
long.
that I come across almost every time I work with someone new, is their perception of what is acceptable for their level of energy throughout the day changes as they make improvements in their lifestyle, particularly with, as the things that I'm
Yeah.
coaching on, which are very, very basic things. But if they fix their sleep and their hydration, then they have a new reality on what it means to actually feel energized throughout the day. Yeah.
Imagine that. Mm-hmm.
So you have a focus on women's health, hormonal health, and as you put it,
Mm-hmm.
crappy periods. So
Mm-hmm.
obviously you are a woman, so I'm sure you have some personal passion around that, just being relatable. But why the focus on
Mm-hmm.
women's health?
Well, women's health, and this is the third time I've kind of been asked this in the
Okay,
last 48 hours, which is fun. No, it's like, why do you have this
yeah,
mission for women's health? And it's because women's
mm,
healthcare is broken.
yeah,
It truly is. And just kind of like what I mentioned in the very beginning about, women go see their doctor and they're like, I feel like this, I'm gaining weight, I'm crying all the time, or I can't sleep. Oftentimes the period isn't really an issue because that with the period, it's like that's normal for them. So they think that their crappy
yeah,
period is normal, but their hormone symptoms are also related to I'm tired, I'm gaining weight, my mood's all over the place. Maybe I have acne, I have headaches, I can't sleep at night. So it all goes back, to the hormones. And then usually I would say probably 9.9 out of 10 times they've got something abnormal about their period. It is very, very uncommon for me to discuss period symptoms and be like, whoa, you actually have like a really
okay,
good period, because not very many people do, and not many women do. And most times women dread that
hmm,
time of month. They suffer more days out of the month than they actually feel good. And that's due to their hormones. And this does not have to happen. But they've been
yeah,
told no other option. They've been told that that's just the way it is. And their only options to maybe fix it is to take birth control or do maybe some sort of surgery, whether that's a partial hysterectomy or an ablation or something like that. And I'm like, that is not fixing anything. Like, it's
yeah,
not fixing it. So let's figure out why. Here we go, back to the why. Like, why do you have a crappy period? Is it because you have a hormone imbalance? Is your estrogen too high? Why is your estrogen high? Oh, well, it's probably because we're exposed to all of these endocrine disrupting things in our environment, the toxins, the chemicals, our diet, seed oils, you name it. Like, we just live in such a
yeah.
toxic environment. So that's why I love women's health so much. And it's funny because when I went to school, well, I didn't really like female health,
It's
and I
complicated.
and I think it was because it was hard.
Yeah, it's
It's
very
hard,
complicated.
right? And every body is different, and hormones are hard. But then I just, like, year after year after year, I've been in practice now for over 7 years, and it's like I've just seen the need, and I really had to kind of pivot my messaging a little bit because I really wanted to help with the
Hmm,
periods, but I wasn't really getting an influx of patients to see me for their period because they thought it was normal. Again,
yeah,
periods have been normalized and it's an elephant in the room, and nobody talks about it. I just saw a post yesterday on my neighborhood site, and it was from an anonymous person. She goes, this is like really embarrassing, and she was like talking about her period. I'm like, it
yeah,
shouldn't be embarrassing. Like,
yeah,
it's not a fun process that we go through as a woman, but it's actually a very beautiful process. And if we understand the hormones involved, like, we should be able to use the hormones to work for you and not against you. And nowadays, most of our hormones are working against us.
yeah. The endocrine
So
system is very, very
that's why I have
complicated, but
such a
also it seems like very
passion.
sensitive as well.
Absolutely. And that's where, we want to have more good periods and bad periods. But if we have a bad period, then we're
Yeah,
like, why? What happened the months leading up? It's like, did we travel? Maybe we ate out more. Maybe we had that, death in the family or something traumatic happened, or maybe you got a new job or whatever the case may be. We're looking at, things that can influence our hormones. Like I know a lot of cycles were off, starting at the pandemic. A fun fact, January and February cycles are usually always off and weird for women because we come off the holidays, and the holidays we're exposed to, increased travel. We're not usually in our routine. We eat foods that we're not normally used to eating, a little bit more sugar because of the treats. Maybe we're visiting family. Like we're not in our routine. So that typically throws off, January, even February periods. So just by, again, going to the awareness and the why, like, all right, well, is my period, could it be better? Am I miserable like most of the month? That's where we can start with, checking in with yourself and seeing. But yeah, that's why I have such a passion for it, because so many women are suffering and they don't need to suffer, and they've just been dismissed and given just a poor advice. And it's really disheartening to
So what is
hear.
a good period?
It literally should come and go and just be a mere nuisance. And that's it. You should have no debilitating symptoms. Maybe the only thing that I consider normal is like, you should feel a little bit more fatigued, but not to the point where you can't get out of bed. The reason you feel fatigued is because your hormones are at their lowest. So that's normal to feel a little bit tired and like not motivated around your period. The other one is, tolerable cramps. But if you're having to take fistfuls of ibuprofen, using heating pans, or heating pads in the fetal position, throwing up not normal. And then also like maybe a little bit of moodiness, but not to the point where you're like a complete witch or your family is like, what in the hell is wrong with you? That's, hormone imbalance, any other symptoms like acne, bloating, headaches, the heavy flow is a big one. If you're having to change your product, less than 2 hours, way too heavy. So those are some abnormalities, but literally it should just come and go and be kind of just a nuisance more than anything.
I was shocked. I mean, it's been years since I learned this, but I have women in my life that have been on birth control since they were 13, 14 years old because of this horrendous cramping that they experienced at that young age. And that was the solution. And that's what they've stuck with for their entire lives. 30 years later, they're still on birth control to manage their menstrual symptoms.
Well, let me touch on that if I can, because that's another thing that I'm passionate about. Now, I'm not anti-birth control at all. There is a time and a place for birth control. It's controlling birth. Nowhere in birth control does it say that it's supposed to help with periods, because it does not fix your period at all. What it is doing is the pill is cutting off the communication between your brain and your ovaries to produce any of your hormone. So it appears as though it's fixing your period because it's suppressing your ovarian function. Like you're not producing any of your natural hormone. It's being replaced by synthetic or fake hormone in the pill. And everything about the period is fake. So you have a fake period, you have fake hormone. You typically have low libido because now you have no testosterone. You're gaining weight. Like there's this whole slew of side effects, anxiety, depression, like all of these things that can come with the birth control. And it's not fixing your period. And guess what? You're at higher risk of infertility. You're at higher risk of cancer. You're at higher risk of early menopause. Like you're at higher risk for a whole slew of things down the road the longer you stay on it. Now I get it. There's a time and a place for it, but it's not fixing anything. And that's, the disadvantage of conventional medicine. It's like, oh, here's a pill. And women are starting to realize like, whoa, I don't want to take birth control. So then they're like, either living with it, which they shouldn't have to live with it, or seeking alternative theories and, methods, like finding someone like me or a functional medicine doctor or someone that can help them figure it out. And like, why do I have this heavy period? I don't want to take birth control, but man, I'm miserable. So that's my whole spiel on birth control. Now, even IUDs
I was going to ask
same
if
thing,
the IUD
like
and the injection and all that is kind of works the same.
So yeah, the depot, I mean, I'm not a fan of suppressing periods. it's part of being a woman. Like it's something that we need to do. It's actually, like I said, a beautiful process. Your period is your fifth vital sign. Other vital signs are like your blood pressure, your heart rate, your respiratory rate, things like that. But it's like your fifth vital sign. So if it's off, then there's we've got other issues in the body. It's not just your period. Now, if we suppress the period, it's like, well, now you're missing out on all of that fun that you can do with your hormones if they're balanced. Because like I said, you can use them to work for you if you know what's happening during your menstrual cycle. And that's what I do a lot of teaching on, is what happens during your menstrual cycle. And that's when I say menstrual cycle, it's you know, we cycle day 1 to 28 or 32. Like that's your whole cycle, and your hormones, like I said, are different yesterday than they were today, et cetera. So we can use them for our advantage, not a disadvantage. So the depot will just, you know, typically take away your period altogether. The IUDs, usually the ones with the hormone in it, like Mirena, Kylina, Skyla. I'm saying them wrong. Anyways, the ones with the hormones have synthetic progestin, which is the fake progesterone. Typically, women on those do not bleed either. But the copper, the Paragard, is a non-hormonal. The progestin ones, the Mirena, the progestin makes the cervical mucus really, really thick, so that sperm can't get its way through. So that's the mechanism of the IUD, that one. And then the copper is toxic to sperm. So that's the mechanism of that. Now the IUDs do not cut off the communication between your brain and your ovaries. However, we still see hormone imbalance. So copper has an affinity to estrogen. So it can actually increase estrogen in the body, which if you already have an overabundance of estrogen, which most of my patients do, then guess what? It's going to make your periods a lot worse. So oftentimes women that get a copper IUD are like, oh man, my periods are atrocious, and they weren't this bad before. So usually IUDs are more for used nowadays for more birth control prevention than, you know, period help. You know, the pill and the depot and things like that are more for using it for periods. And I say that rolling my eyes because that's not what it's used for. But yeah, I still see hormone imbalances all the time with the IUDs. So either, you know, if we're talking birth control, I mean, my favorite way is to educate a woman about their menstrual cycle. You'd be surprised at how many women think that they can get pregnant every single day of the month. And that's false. So that's where, if we get in tune with our body using, you know, fertility awareness, tracking your cycles, seeing when, you know, you might possibly ovulate, you don't need to take birth control. You can use a barrier method if you're afraid or, you know, worried about it, like a condom or diaphragm or something like that. You don't need to take hormone stuff to, you know, make things oftentimes worse.
So for bad periods, is that always due to hormones, or are there other factors that would contribute to that?
Oh, yeah, it could be other things. It's usually a combination of, it could be diet, it could be inflammation, it could be pathology reasons, like maybe we have a cyst, maybe we have a fibroid, maybe you have a condition called endometriosis or adenomyosis. Those things can influence periods in a negative way, but hormones can drive these things too. We might have a clotting disorder. I actually just found this in a patient recently, and I was like, all of her hormones are actually balanced and she has no pathology as far as a cyst or fibroid. Her endometrial lining was great. I'm like, well, let me run some clotting factors. Sure enough, she has trouble clotting. So now we're fixing that. And guess what? Her period, she was like floored. She's like, are you kidding me? I was able to leave the house.
Wow.
Like, that's when you know you have an issue with your period, if you can't leave the house because you're afraid you're going to leak somewhere. But yeah, so it could be other reasons, but I would say 75-80% of the time there's some sort of hormone component. It could be your thyroid too. So that's why the thyroid plays such a huge role. It could be stress driving it. I mean, that's a big factor of a lot of health symptoms is stress and unmanaged stress. And I'm sure you see that in your industry as well. And, you know, people use exercise for stress management. And is that good? Maybe. But it might also be doing some more harm than good, depending on how their adrenal function is.
Yeah, that's really interesting. And so of the hormonal imbalances, obviously there's estrogen, there's testosterone. I would progesterone then come into play as well, all the time?
Oh yeah.
Okay.
Yep. Well, so estrogen is primarily, or the women's most predominant hormone
Yeah.
in menstruating years, is produced primarily by our ovaries. And then, excuse me, progesterone is only present on the last half of the menstrual cycle if we ovulate.
Okay.
So that's where I see a lot of hormone imbalances or, infertility, conditions like PCOS where we might not ovulate. If you don't ovulate, you don't make progesterone. Now you still can have a period and not ovulate.
Hmm.
So that's another big myth that I hear a lot. So estrogen and progesterone really need to be in this like
Okay.
beautiful balance. Why? Well, estrogen is a bloater. Estrogen makes us retain water. It makes us feel more inflamed and can, cause things to be worse, like with pain, the flow. And progesterone is like a natural diuretic. So it actually will help clear some of, the bloating and the poofiness. So that's why we need to have them in a really, really nice balance. And why, as I mentioned earlier, I test on that last half of the cycle because I want to see where progesterone is in comparison
Okay.
with estrogen. So yes, those are the two primary ones. Now, when it comes to weight loss, libido, drive, motivation, energy, even like just general vitality, testosterone is a huge factor in that. And it's estimated that a woman in her 40s has about half the amount of testosterone that she
Okay.
did in her 20s.
Wow. That's
And
drastic.
on the male side, yeah, no, it's a huge one that I see depleted all the time. And on the man's side, it's the man's primary hormone. Same thing with men. Like it declines as you age. Your testes just don't produce the same amount as you did in your 20s and 30s. Now, if I have a 20-year-old or even a young 30-year-old man in my office and they have low T, I'm like,
Yeah.
why is that? Do we have, maybe the testes aren't operating well, so we'll do some ultrasounds or things like that. But yeah, so testosterone is a
Right.
huge one for women. Women need it as much as men, just not as much as men. It could be game changing for a lot of things, especially when it comes to weight loss. What else? We've got, like, I'm looking at ovulatory markers like follicular
Okay.
stimulating hormone
Yeah.
and
Yeah.
luteinizing hormone. Those are what the two hormones that stimulate your ovaries to release the
Right.
egg for ovulation. I'm looking at DHEA, which is like also produced by the adrenal glands, but a precursor to like testosterone. I'm looking at prolactin. Prolactin is a hormone that is produced by our pituitary, but really should only be elevated during lactation or breastfeeding. Other than that, it shouldn't be. So if it is, we're looking at the Y. It could be gut, it could be B vitamins, it could be stress, it could be alcohol, but it can inhibit progesterone production or ovulation. Also, in men, can inhibit testosterone production if it's high. I'm looking at my list of labs in my head. Sometimes I look at pregnenolone. We're looking at sex hormone binding globulin. Like those are the big reproductive hormones that I
Okay.
oftentimes test.
And so if you're taking a, let's say, naturopathic approach to correcting hormonal imbalance, so,
Mm-hmm.
prior to, I don't know, giving exogenous hormones or something, um, is it diet? Is it like environment? What are you looking at for? Okay.
All of it. Yep. Well, well, the top of the hormone cascade actually starts from the
Okay.
sun. And from the sun, we
Well,
synthesize
we're
and
all
make
scared of the
vitamin
sun
D.
now, so
Vitamin D,
the sun is terrifying.
yeah, everyone's scared of it. So that's why, I'm in Arizona and we see the sun every single day. And I would say probably 90% of my patients are
Yeah.
vitamin D deficient. So we'll start there. Now, don't go out and supplement vitamin D. I've seen it go backwards, especially during the pandemic when everyone was like, take vitamin D. Well, we don't want too much vitamin D. So make sure you get your
Mm,
levels checked first before you supplement. And then we're looking at cholesterol metabolism. So we're looking, and that goes into diet. So say you have really, really low cholesterol, which you're like, yay, I have low cholesterol. But wait, we don't want too low because cholesterol helps make and metabolize our hormones. So if it's really low, I'm like, what are you eating? So I have a really good example of this. I have a patient that was on birth control for several years, stopped it in fall of 2022 and hasn't
oh
had a
wow.
period since. Well, I found out she has an autoimmune condition with her thyroid, which was not managed well. So we started to manage her thyroid, and now we're working on hormones. I'm actually trying to technically induce ovulation per se, so we can try and get her ovaries to turn back on. But now I'm really looking at nutrition. I'm like, why is everything so low? Like, is she getting enough nutrients to really stimulate, the good, I guess, caloric intake to have a period? Another good example is prime time. I don't know when this is going to come out, but right now the Olympics are on. So we know these athletes are, super training. And if you overexert yourself and do a lot of intense training, and your period can go
Right.
away. So I bet you Simone Biles has not had a period in several months, maybe years, just because of her athletic nature. It's very common. Is that normal? No, but at least we know the why is, over training and over exertion, which all of these athletes do, because that's just the nature of their career and what they love to do. But back to this patient, same thing. She was training really, really hard. She's a petite individual. And I'm like, you know what? I don't think you're eating enough. And then I went through her diet and I was like, yeah, this is processed. This is processed. Like, let's try and get some like whole nutrients in here, like some real, like food, like real food, home cooked food, and see, up your calories a little bit, because she's now starting to get at least PMS symptoms. Like, she was feeling some cramping and some bloating and some moodiness, but we still have yet to have the period. So I forgot where I was going with all of that, but that's a good example of like why a period might go away.
But
you were saying how we address it with the diet. Yep. And then the cholesterol I was telling you about. And then, we'll do supplements. So most of the time women have, and even some men, like, they have a lot more estrogen than they need. So we can work on liver metabolism. That's a huge component of balancing hormones, is like, well, what's your liver doing? So your liver really does everything in the body. It's processing what you eat, what you drink, what you take, what you smell, what's affected in the environment. It's doing everything. And then it's metabolizing and making hormones too. And we go through something called phase 1 and phase 2 detox in the liver. So oftentimes it's doing a lot of things. So if you don't give the body, what it needs for the liver, it's going to have, it's called liver stagnation, or the inability to properly clear and metabolize, excess things. So we're looking at that. We're looking at gut, and then, giving the body the essential nutrients that it needs, to do its job. And then, in menopause or even andropause, like, there is 100% a time and a place for hormone replacement therapy. And I'm also looking at quality of life. Like, how much is this affecting your life? Like, is your relationship on the brinks because your libido is like non-existent and your husband's like ready to file for divorce or put his eyes on somebody else? Or, that's a huge component too, is like, how much is this impacting your life?
It's really interesting. My wife went and did some labs with a naturopathic doctor through a personal training facility she was going to a couple of years back, and they saw that she had very low testosterone, and they put her on seed cycling. So she was mixing different kinds of seeds into her smoothies. I forget it, depending, different seeds, different time of day, or different days of the week, something like that.
Different parts of the cycle, the first half and the second half. Yeah, I use seed cycling a lot.
Yeah, and she never did a follow-up appointment with that doctor, so we never saw whether or not, she gained any benefit from doing that, but she was doing it for a while.
Oh man, I was going to ask, like, did it work?
Don't know.
Yeah. I mean, there are some people that want to just do it, 100% natural. They don't, I always like to see where we can get stuff from our food, but I also meet them where they're at too. Like, I can't just turn someone's diet in a complete 180. So if they're already eating really, really healthy, I'm like, here's my list of foods to add more B6. Here's my list of foods to add more vitamin D or magnesium.
I love that.
I try and be like, here's iron rich foods. Like, you're already doing really well with your diet and this is important to you. So here, I'm going to try and add more of this to get the nutrients rather than have you take another supplement.
That's awesome. And I know that a lot of vitamins and minerals have kind of codependencies on other vitamins and minerals. So I feel like eating it, getting that intake the natural way just kind of would naturally then balance that out. Whereas if you just take the supplement, then, maybe it creates an imbalance.
Yeah. And the whole diet thing, that goes back to like our conversation several minutes ago. It's like, if you know, we were never taught how to eat, and we have all of, the propaganda and the ads and all of these, celebrities endorsing things that just,
Yeah.
aren't healthy for us. But if you start to eat healthier, okay, I would just say healthy. Maybe you think you eat healthy. Maybe we start to eat healthier because we can all improve, including myself. You will notice a benefit, and you will notice how much more energy you feel, how much more mental clarity you feel, how much better you sleep at night. Maybe you'll even notice that your clothes fit a little bit looser. Maybe you have better performance in the gym because you have more energy and drive and motivation. Like, I just, you don't know what you don't know, and you don't
Yeah.
know unless you try it. So I always like to challenge people. I'm like, just try it for a couple weeks and see how you feel. Like, gluten is a really good example. And I can, attest to this for my own personal health. I have an autoimmune condition called Hashimoto's. So I typically pull gluten for most of my patients that have that because it's very
Yeah.
aggravating to Hashimoto's. And I ate gluten up until I had this diagnosis and I pulled it. And then, I'm human. I eat it every once in a while because it's life and I'm not going to starve.
Yeah.
I will eat it. I'm not going to die if I eat it. But I can most definitely feel a difference. And I, challenge patients all the time. I'm like, if you just want to try one thing, I would work on taking out gluten and watching how much sugar you're eating and just being aware of those things and having a huge reduction, if not elimination. I guarantee you will feel better. But if you don't, then add it in and then see how you feel. And I guarantee you will notice a huge difference. Like, whenever I eat gluten or maybe have too much sugar, like we're on vacation right now, so I'm eating foods I normally don't. And I can feel extra brain fog. I can feel, I feel different. I don't feel as like
Yep.
crisp and clear. Also, I'm out of my routine, things like that. But, if you take them out and you're like, oh, I didn't really notice a difference, well, add it back in and
Right.
then see how you feel. So that's where, too, it's like it goes back to the cookie cutter. There's not one clear cut path for every patient, and there's no one clear cut, diet for everyone. You have to do what works for your body and experiment with different things. And don't say, I got to do this and I'm going to lose 10 pounds because
Right.
that girl lost 10 pounds. It might
Yeah.
not work for you, but this other way of eating or doing might work for you better. So that's where just making sure that you're in tune with your own body and trying it and trial and
And funny
error.
that you say that, because I experiment on myself a lot with different types of dietary changes, dietary lifestyles, supplementation. If I learn about something that supposedly is good, then I might give it a try. And I feel like the way that I'm in tune with my body is kind of like what you just said, but the reverse of what people expect, right? Where when I do something new, I don't usually notice a drastic difference. But then when I back off of it, that's when I notice the difference. So exactly
Mm-hmm.
what you just said. And I'm in a similar
Yep.
situation to you. I generally eat well. Yes, I could improve many things, but I generally eat well. And when I don't, I always know, I'm like,
Oh
oh,
yeah.
I knew this was coming. Like, I feel bloated, I feel sluggish, brain fog, all that. And
Yep.
I've never been diagnosed with anything specific to any kind of gluten intolerance, but I do know that when I eat gluten, because I've taken gluten out of my diet largely, whenever I do eat gluten,
Mm-hmm.
I may get bloated, I may get crampy, I may get gassy. Like, these things
Yep.
just happen when I bring gluten back in. If it's in anything, if I have like a
Yep.
couple of crackers, probably nothing's going to happen. But if I, have a handful of crackers and maybe a sandwich, then chances are I'm going to be feeling that later.
Right. And that's where you just experiment with things for your own body to see how you feel. And we know the inflammatory foods like gluten, sugar, processed foods, alcohol, things like that. They're all super inflammatory. So if you just try and reduce them, or just start with the awareness, like, how much of this am I
Yeah.
consuming? You'd be surprised, like, how much gluten. Oh shoot, I had gluten for breakfast, I had gluten for lunch. Ooh, I just had some crackers. Oh, dinner tonight's pasta. It's like, wow,
Yeah.
that's a lot of gluten. So maybe cut that back and see, or go gluten free for 2 weeks and just see how you feel. It's really easy to eat gluten free nowadays, compared to how it was,
Right.
several
It
years
is.
ago.
It
So
absolutely is. And I started going down
yeah.
the rabbit hole of anti-nutrients and lectins and all that, and it just became
Oh yeah.
overwhelming, and I felt like I couldn't eat anything except
It
meat. So
Yep.
so I
It can be very, yeah. And sometimes,
yeah.
carnivore works for people. That's another big one right now. It works for some people. Like I actually just did, this is really interesting for my own self. I just did a whole bunch of genetic stuff and something came back that I don't metabolize like I have a SNP or a genetic issue with protein metabolism. So actually a higher protein diet for me might not be
Wow.
what I need. Whereas, as a society and like even what you do in the fitness world, it's like,
Yeah.
you got to eat protein. You got to eat a lot of protein. Well, that might not work for everyone. So I just am, playing around with, maybe I'm going to reduce protein a little bit and see, how that makes me feel and see if I see any results with that. But I
Yeah.
just thought
Yeah.
that was interesting. Because, again, like you have, every body is unique and you just have to, experiment. I've interviewed people on my podcast that are like, I call them, they're fruitarians. They just
Wow.
eat fruit. And that is what
And are they
they
healthy?
are like.
Okay.
Yes.
That sounds all right.
I mean, that works for them. Same with like carnivores, even like keto might work for some people. It
Like
doesn't work for
my
everyone.
5-year-old lives on
So
fruit
like
and protein shakes.
my other half, he's a firefighter and he's in like really good shape and he eats like a toddler, like he eats horrible. But if he eats really healthy,
How
he gains
interesting.
weight. So, I mean, again, there's no one diet and there's no one protocol and there's no one fix all. I mean, whoever could invent that, great. But I don't really think that there's one thing that can pertain to every single person
Yeah.
besides maybe water. Like water is super important. And I think everybody needs water. But after that, I mean, you just kind of have to play around with
Yeah.
what works with
That's
your body. But get your labs done because then you
okay.
can
I
see what
will.
your
I
body
will. I
needs
will.
and you can,
I know. I
no,
know.
not just
I
you,
know.
everyone. But then because there's so many times that patients come to me and they have like a laundry list of supplements. I'm like, why do you take this? And they're like, oh, well, I heard it can,
Yeah.
help with this. Okay. Great. Like, yeah, it's a great supplement. Do you need it? I don't know. If it's helping, sure, but I'm going to give you what you need. So now you're going to add on probably 3 to 5 to 7 more supplements. Like, and then you add in the 20 that you came in with. Do you really want to take all those? So it's not going to be harmful. But again, let's give your body what you need. And we're only going to know that if we take a look at the
Yeah.
insides and
And I
see
work with
with
a
your
company
labs.
that does labs to then prescribe customized supplements. But I
Oh,
would be very
perfect.
curious to then, go to a naturopathic doctor and kind of get the same thing on that side and see how that compares.
Yep. Yeah.
All
Yeah.
right, I have a question for you because I told my wife that I was going to be talking to you, and I said, what do you want me to ask? And so she was recently had an ultrasound done, and they found a small 3 centimeter cyst in her ovaries. They said this is normal. It's small, nothing to be concerned about. You've had a couple of pregnancies, so don't even worry about it. But of course, she wants to know more about it, and that's all she's getting from the doctor. So she said, ask her about ovarian cysts.
Yeah. So, I mean, cysts are, it's a diagnosis. Like, it's obviously not something that's normal. So, there's the one
Okay.
false answer that
Okay.
it's not normal. They should not be there. Your ovaries should not have cysts. But why is it there? So then we look at, maybe it's driven by estrogen, maybe it's driven by inflammation. Those are like the two common things that I see, causing these pathologies. It could be driven by even poor gut health. Those are some big reasons why we might have a
And
cyst.
just so
Now,
we're clear,
if it's
poor
not
gut health
causing,
isn't the same as poor diet, right? Correct. Okay. Because I think
no,
some people
absolutely
have that
not.
misconception.
Yeah.
Poor gut health and poor diet are not the same thing.
I mean, a poor diet can contribute to poor
Yeah.
gut health, but on the flip side, like poor gut health doesn't always have to be like I don't have the most robust gut health, but I
Yeah.
eat really clean. But I didn't
Yeah.
eat clean my whole life, so your gut, like, and that's a lot of our environment as well, and even the quality of our foods nowadays, and all the pesticides and chemicals and things that are on our foods that can
Yeah,
disrupt
I
our
was gonna
gut
say, so it's gut
microbiome.
microbiome. Is it like the porousness, like leaky gut? Would that be considered gut health as
Yep.
well? Okay.
Yep. Could be influenced by things in your past, maybe high antibiotic use. It could be lack of nutrients. It could be stress. It could be pain, like taking pain pills. Like, say you have crappy periods and you're taking fistfuls of ibuprofen or Midol, like that all
Okay.
disrupts the gut microbiome. So, and then, like I said, we don't get enough of the good stuff
Yeah.
from our diet anymore. It's just not in our soil. So that can contribute to, a myriad of things. Does that form cysts? No, but it can, have if we reverse engineered, it's like, well, we might not be absorbing well, which can lead to inflammation, which can drive estrogen, like, all of
Okay.
these different things. So yeah, it could be a combination of things. It could be hereditary. Maybe her mom it was a cystic person. I mean, I think a lot of cysts are driven too by environmental
Yeah.
toxicities and endocrine disruptors, and the chemicals that we put on our skin, our hair, our makeup, or what we're cleaning with. Like, it's all of it.
And so if I was going to advise her based on this, I mean, is it go talk to a naturopathic doctor that can tell you more than this is normal, or get some.
Well, I would back up. I wouldn't ever do a pelvic ultrasound without checking hormones and seeing, like, all right, well, maybe, the cyst is driven by estrogen, or maybe a lack of progesterone. I would assume if you're in your early 40s, she's, probably not super. I wouldn't. How old is your wife?
She is 40.
Did you want to?
It's fine. Who doesn't love a dog?
It's real life.
She's 40.
She's 4. Yeah. So, I mean, definitely she's, in her 40 or starting in her 40s. So perimenopause is happening. So hormones, can start to shift. Does she have to suffer? No. But same with you. If I think I've met several people lately that just haven't, and they've never had their hormones tested, but that's not their fault. It's because their doctor doesn't think that they matter. Your hormones 100% matter. So I would find, even she can go back to that doctor that did the ultrasound and be like, can you run my reproductive hormones? Like, sometimes you just have to ask, and they, or they won't offer it. Same thing with, like, you with you were mentioning about the bone marrow cancer with your father, and how you had to, like, ask the doctor about alternative things. And then they finally came, and it's like, well, they're not going to offer it. But if you ask, then they might. Or, you guys both go see an ND in Orange County, and they'll most definitely help.
Yeah, I think we're going to go that route, because I'm interested. And, she got a taste of it a while back, a couple of years ago, but didn't follow up. So it'd be interesting to kind of see how things have gone since then. The last time I went to I have a GP that I don't really know, because I don't really have problems. But one time I did go to him and told him that I just wanted kind of a general wellness check or health check. And he said, why? I'm like, well, because I'm just curious. But you're healthy.
Yeah. That's when I would have walked out the door.
So you don't need that. Okay. Thanks, doc. I guess I'll come back when I'm dying. Awesome. Well, Dr. Ellis, this has been an amazing conversation. This is the conversation that I've been wanting to have for a couple of years now. So I really appreciate you taking the time out to come on the podcast and educate me and everyone listening about naturopathic medicine, and just the fact that, we can control our health, and we don't have to just worry about having someone else help us control our sickness.
Absolutely. It's been a pleasure. I love teaching. I love sharing things like this, talking about different scenarios, and I hope, you took everyone that listened to this, including yourself, took at least one thing away, whatever that might be. Share it with me when this comes out. I'd love to hear what your number one takeaway was. But
my pleasure. And if anyone is out in the Gilbert, Arizona area, and you're looking for a naturopathic doctor, go find Dr. Ellis. I will link to your website and your social in the show notes for today's episode at the superhumanblueprintpodcast.com. Dr. Ellis, thanks again.
Yeah.
Okay. Bye.
Thanks, Drew.